Assalamualaikum warahmatullahi wabarakatuh. First of all, my name is Wadajaman Hanif bin Abdul Halim. Will be your moderator for this forum. So, before we begin, I would like to express my gratitude to our and thanks to our lovely daughter, Dr. Hafiza. And now, as you all know, with the new normal and due to the COVID, we have led to do so many basic things in quite different ways. So one of the main changes is learning to do most daily activities such as shopping, attending meetings, and having family gatherings online. So healthcare services have also moved online to reach out both existing and new patients and clients. People are now able to book medical appointments, attend consultation, and order and have their medications delivered, all with a few one taps on the digital device online. So, online therapy and counseling for mental health issues via email, phone, online chats, or video calls have also become popular in recent times. Seeing a mental health professional such as psychologists or a counselor is on the rise, and more Malaysians understand and appreciate the importance of good mental health. So, the question is, would you prefer to seek online therapy for mental health issues? So, before we begin, please allow me to introduce our remarkable and excellent panelists before we started. So, alright, the first panel known as Muhammad Kushairi, and the second panel is Nur Aliyah Aida, and the third one is Muhammad Azli. Now, without further ado, let's start our forum by asking the first panel, what is your thought about this issue?
Wishing a very good morning to my moderator and all the panel. My name is Muhammad Kushairi as a panel 1. In this issue that we discussed today, which is prefer to seek online therapy for mental health issue online. So, the first point that I would like to highlight in this discussion is I prefer an online session compared to face-to-face therapy. Some studies are shown that live session online therapy already has changed the mental health community by helping increase access to life-saving support for millions of people. Online therapy also provides accessibility to individuals who are disabled or housebound, which is clients can undergo therapy in the comfort of their own home. Moreover, studies have proved that online therapy can be effective for patients with light to moderate depression, as well as panic disorder, social anxiety disorder, and generalized anxiety disorder. People who are unable to leave their home for various reasons, such as physical or mental illness, may find this online therapy as a useful alternative. Based on Stephanie Giuliano, online therapy also enable those with disabilities to attend the therapy who may not have been able to previously. On the other hand, online therapy offers access to mental health treatment to people in rural or remote areas, which they need to drive a long distance and take significant time out of a busy schedule to seek in-person therapy, which can be a burden for people in need of help. In this situation, they can also choose a therapy who is outside their immediate geographical areas, thus increase their option to find therapies that they trust or comfortable when they share about the issue. For my second point of view is online therapy is usually fairly affordable and convenience, since you have to attend the live session, so you can schedule your session for the time that you want. Other than that, you can get a service outside of normal working hour or on weekend, so that will make you more convenient. Moreover, you can use a chatting method where the client and the therapist need only respond when they are available to online or free to reply. For your information, most of the therapy session cost less than face-to-face one. For example, clients are also able to save on travel and transportation costs. Apart from the advantage to the client, the therapists who only treat patients online likely have fewer overhead costs, which as renting office space. So, uh, they can offer affordable treatment option for those who are not covered by health insurance.
Sorry, Kusari, but I disagree with you because we as a client doesn't know the background of the therapist that we choose in online. Like you said, yes, it was easy for us, and it can also save our time to do therapy through online, but it does not promise us the security and our privacy while we do in the online therapy. Because there are many cases in Malaysia where the scammer create their own identities and pretend to be the therapist, doctor or others in order to get our information and scam our money. Not only that, client data such as name, home address, more can also be leaked because the technology is now easy to be hacked. Such data can be sold to make money, and it makes it easier for the scammer to do their act.
I agree with what panel 1 said, that online therapy is accessibility and option for people with physical limitation. This is because online therapy is ideal for people who find it difficult to meet with their therapist in person. Individuals who use online therapy can begin or continue conversation with their therapist at any time and from any location where they have an internet connection. However, the disadvantage is that you and your therapist are both at the mercy of your internet service provider. Another disadvantage of working remotely is that it can make it more difficult for therapists to help you in a crisis situation. A therapist's role is to ensure that the client is always safe, which is much more difficult when they are not there. For example, if a client is experiencing suicidal thoughts or has suffered a personal tragedy, it can be difficult or even impossible for the therapist to provide direct assistance. That is my opinion.
So wow, we could see that there's a little bit of argument that have been going there. So without wasting any time, so I would like to ask panel 2, what is your point of view about this particular issue?
In my opinion, I more prefer with face-to-face therapy rather than online therapy. It is because we communicate is from our facial expression, tones of voice, body language, and also gesture. If we do the therapy through online such as email, messages, and calling, it is harder for us to understand well. People may find it difficult to put complex thought and emotion into the written words. We transmit what we want to talk to one another face to face and in the same room. Very easy for the client to misunderstand what the therapist is saying, while for the therapist misunderstand what the client is saying. People say less when writing than they would when speaking. It can reduce the amount of information available for the therapist to work from. Therapists also cannot as easily access body language information even they are doing the therapy through video chat. Therapists are at the greater risk of missing important nonverbal cues. Since online therapists are distant from the client, it can be difficult for them to respond quickly and effectively when a crisis happens. For example, people who are having difficulty will always need somebody by themselves. And the most important is the therapist need always keep them moral, speaking to them and persuade them, but it will difficult through online to do all that thing because therapists need be online 24/7. And in addition, confidentiality, privacy, and unreliable technology also can occur while we do the online therapy. This is because since information is being transmitted online, the situation makes privacy leaks and hack more of a concern. If there is a technological failure, such as the patient computer going down or an interruption of service for the therapist, can cause information leakage. Like saying before, the danger of identity fraud, for example, discussed as therapy, can occur. A new issue had emerged in recent years with regard to the licensing. How well to know about the therapist if we doesn't meet each other? We don't know if the therapist has license or not if making online therapy. There are many cases of unlicensed therapists or their licensing being blocked. For example, actually their license is being blocked, but to cover it, they are doing in the online since people doesn't know about that.
I'm sorry to interrupt you, Aida. I don't agree with Aida's points of view since we communicate online more and more in today's society using platforms like WhatsApp, video call, and online meeting. The argument is since our world currently restricted in our movement due to the COVID-19 virus, internet communication offer an option for long-distance therapy session between client and therapist. Additionally, message also give us the choice of replying immediately or whatever it is most convenient for us to take the time to revise or polish our message. According to the studies, live session online therapy has already had a significant impact on the mental health fields by making life-saving support more accessible to millions of individuals. Finally, I thought that in the fast-paced world today, internet communication offer an overall benefit for us in this day. Thank you.
I agree with what panel 2 said. Although all legitimate therapies are required to follow confidentiality and privacy guidelines, internet therapy may represent a bigger security risk than in-person session. Someone may hack into your computer, your Wi-Fi network, your therapist's computer, and so on. And because of what you reveal may be quite sensitive, privacy issues are significant. Online unethical, uncertified counselor may find it simpler to operate. Some online therapy clients may be putting themselves at risk of receiving useless or even dangerous mental health advice. Even legitimate therapists working in other nations or even states may not require the same level of certification. When using the service of online counselor, you must take precaution. That is my viewpoint.
Alright, moving out to the next and the last panel, which is Azli. So, what is your opinion about this topic?
Thank you, Mr. Najman. Assalamualaikum warahmatullahi wabarakatuh to all my beloved audience that attend to see this forum. First and foremost, I would like to thank the organizer for inviting me to deliver some benefit information about our forum today. The title of our forum today is Would You Prefer to Seek the Therapy for Mental Health Issue Online? After hearing the arguments from the two panels, we were able to identify some of the pros and cons of online therapy. However, my stance on this topic is to neither reject nor completely endorse online therapy. In my perspective, In this day and age, we should strive to combine the two benefits of online therapy and face-to-face treatment. This because both of these methods are important for us to utilize while treating mental health patients. Therefore, the best option for me is that I choose and prefer the blended care method. Blended care refers to the combination of face-to-face therapy and online therapy. Among the benefits of blended care for mental patients who use and implement this method is increased self-care. Blended care has the potential to increase patient accountability and responsibility for their own mental health, which are important components of activation and patient health engagement. The practice of therapy is no longer limited to the occasional face-to-face appointment with a mental health professional. Patients can, in some way, direct their own therapeutic process. For example, this may be done by patients communicating with their psychiatrists about their health progress using mental health application that patients must use on a regular basis as part of their therapy to monitor their own feeling or behavior. Might lead to a greater understanding of how specific trigger life experience, for example, influence people psychologically, and when it is necessary to meet face-to-face patients will meet their psychiatrist for a brief session. This recognition is important to therapy and can be difficult to achieve through traditional therapeutic methods. Blended care guarantees the therapy fundamental information and exercises are delivered and monitored properly, and it is encouraged patients to take a more active part in their own treatment. In a research conducted by Wilhelmsen on an online intervention supported with a brief face-to-face session, participants claimed that the face-to-face meeting were helpful and motivating, and some even state that they were absolutely required to engage in the online component. All of the things I described will not be achievable if we solely focus on online therapy or face-to-face therapy. My next justification for choosing a combination of in-person and online therapy is that it is incredibly effective and efficient. I believe it to be really effective because blended care may offer effective treatment methods in the context of a large number of persons suffering from mental health problems and limited professional resources. The client is encouraged to continue his or her therapy in a systematic way between sessions with the therapist. Likewise, blended care has advantage over online therapy since it allows for personal guidance face-to-face when needed, as well as maybe improve treatment adherence. This might make blended care treatments more cost-effective than face-to-face therapy. Clients can still receive therapy with blended care even if their condition prevents them from receiving it, such as those suffering from social anxiety or agoraphobia. Based on the article I have read, Dr. Dalina Hani Fadil Azim and Dr. Danya Pillai indicates a similar point of view. They mentioned that online therapy has also been shown to be effective for the treatment and prevention of depression and anxiety relapse in young people. Next, the reason for my claim that it is efficient is because blended care may save both the healthcare professional and the patient a significant amount of time. Online module can be used to replace face-to-face sessions, saving therapists time and allowing them to take on more patients, perhaps reducing waiting lists. Practitioners may be able to reduce the duration between direct encounters and online follow-up support if they have a fewer face-to-face interaction during the program. This gives patients unrestricted access to treatment materials, allowing them to work on their therapy at home while still benefiting from the therapy session formed during face-to-face meetings. In conclusion, after discussing some justification, I believe that using blended therapy, which include online and face-to-face components, is a great alternative and method for offering patients the best of both worlds.
I'm sorry, may I interrupt in Azli's point of view? Actually, I agree with Azli's point of view. Compared to face-to-face online therapy, less face-to-face interaction can reduce waiting time for both client and therapist. Additionally, I believe that blended provide an additional benefit for all the client in that they can choose the approach that is the best for their situation at the time. According to research from website named Penapto, blended learning reduce failure rate, improve learning, and boost engagement. Blended learning combines the best aspect of face-to-face teaching and online instruction in way that enable students to learn at their own pace. For your information, I know that the study are out from our topic, which is in these studies are actually telling us about the student and the teacher doing a blended learning. But the point that I want to highlight here is the advantage of the blended or hybrid learning, which can improve them solve their problems. Thank you.
I agree with Azli that blended care are effective and efficient. It can save more time for the client because they can combine two methods, which are online and face-to-face therapy. Okay, for example, if the client is busy, they can just do a therapy through online. But if they are having a free time, like they don't know what they want to do, they can just call, meet the therapist, and make the face-to-face therapy. It also can avoid misunderstanding between the therapist and the client, because while we do the therapy through online, and the client can ask the therapist back when they are meet each other, when they are having a face-to-face therapy. It was for me it was easy for the clients, because since they can meet the therapist and also can do in online.
Alright, so that's probably would be it. Thanks to all panels for a tremendous expectation and exciting agreement that kept on going. But then, our forum will be ends here. So before that, from all the information that I've got from all the panels, both blended and online therapy have their pros and cons. Plus, we can apply both of them depends on which method would suit with our lifestyle. So my recommendations are we can use both methods depending on the situation that we are facing. For example, if we have a disability or problems with our physical, so we can apply the first method, which is online therapy. On the other hand, if there are no obstacles, we can use the second method, which is the blended care. So where each has its own advantages. So nothing to worry about. Government also needs to do a survey on mental health issues in Malaysia and help those who are in need having trouble with their mental health. Since we just been set free from COVID-19, that surely affect everyone's lifestyle and financial, of course. The other recommendation is that the simplest way to cure our mental issue is that try to calm ourselves by always praying to and asking for His guidance. That we probably can avoid anything that could harm ourselves from doing illegal things. So that's all for us. Thank you.